Hello everyone. Excuse me. This lecture is a discussion of the case study for Chapter 13. In your textbook, turn to page 123. And as we look at this case study, we can see that we have a chief complaint here of seizures. So this is a 45-year-old. He has a history of admissions for alcohol withdrawal seizure. So our admitting diagnosis here is going to be the seizures, Fa16.9. As we look through this chart, we look through the H&P and we go down and we look at the discharge summary. We can see that his first listed diagnosis here is alcohol withdrawal seizure. We can see that he also has a diagnosis of alcoholism and cocaine use, and these are confirmed when we review the H&P. We also see the diagnosis of hypertension. So, and then the laceration to the forehead, which certainly we want to make sure that we code that laceration. This patient he is in withdrawal and he is having seizures. So in the index, if we go to dependence, alcohol, with, and then we'll find withdrawal, and this codes to uncomplicated. It doesn't code to just withdrawal, F10.239. That's withdrawal unspecified. But we have, he had seizures. Basically, this codes to uncomplicated, F10.230. That's going to be our principal diagnosis code. The patient also did go home. Now, we're also going to code the fact that he had seizures. Once he came into the emergency room, he had 2 additional seizures, and that's documented on page 124. It also tells us that once he was transferred to an inpatient status in an inpatient bed, he didn't actually have any more seizures. They started him on Ativan, and he also got the withdrawal medications, the vitamins that they give these patients. So the principal diagnosis will be F10.230, and we'll also be coding R56.9 for the seizures that he had while he was in the ER. We also know that he is a tobacco. He uses tobacco. That's the only documentation that we have. So if we go tobacco use, we'll see this code Z72.0. You could go to tobacco, let's see, dependence, drug, nicotine, and then cigarettes, F17.210. So some of you may have coded this. It doesn't say that he's nicotine dependent in this documentation. So the Z72.0 is the best code, but if you used F17.210, that's not something that I would take points off for. It says that he occasionally uses cocaine. So we're going to go to abuse, drug, and then cocaine, F14.10. And we'll verify that in the tabular. And now he also has the laceration to his forehead, S01.81, and when we verified in the tabular, we can see it's a red code. It does have to have additional characters, and that is going to be the X placeholder and then the A for the initial encounter. Now, this patient fell, so if you're in a facility that has a policy that you're applying external cause codes, we can say that this patient fell. He had a fall, W19, and actually with this code, it's W19.8 XXXA, all those placeholders, so that we can apply the 7th character for initial encounter. And then also, this was a fall, and it was the same level, W18.30. It just says that he fell. And this code, again, also has to have a placeholder, so it's W18.30XA is the code that we would choose for this. And those are all of the codes that we are coding for this particular patient. We need to determine the DRG. So when we first log into 3M, this patient information page comes up. I changed the gender from female to male, put it in age of 45, and went in and put it admit date of 2 days ago. I think this patient was in the hospital 2 or 3 days. Then I'm going to leave everything the same and hit continue. The first thing I have to choose is the disposition, and we know that this patient went home. He did not want to stay in the hospital, and so he went home. Our admit diagnosis is R56.9 for the seizure. I'm going to type that in and press enter, and then I'm going to press enter again, and now I get to my principal diagnosis code, which is F10.230. I'm going to press enter again. Then I'm going to recode the seizures because he did have seizures while he was in the hospital. And then I'm also going to add the code for the cocaine use. And then I'm going to add the code for the laceration of his forehead. Then I'm going to add my Z code for the tobacco use. And I'll add my codes, the external cause codes for the fall. And all of these are present on admission. So if I go up to present options, present on admission, I can say for all of these that they were present on admission. Now, we did not code the hypertension because when we look at the progress note on day 1, that's on page 125 in your book, it says BP has been normal without medications. So they're not treating it. Now, yes, it was a diagnosis, and in my opinion, it meets the definition because they monitored it to determine whether or not he needed medication. The textbook does not code it, but if you coded it, I certainly am not going to take off any points for that. Once I get these codes in, I'm going to hit compute. And if we know the blood alcohol level, certainly we would want to code that. And then we have some notes here. Tobacco abuse is exempt from POA coding, as is the fall code. That's fine. But we can see that our DRG here is 897. And then the weight for this DRG is 0.7231. So that's the DRG for this particular patient. Now, if you have any questions about this, please let me know. I did not put individual comments in while I was grading because I knew that I would be recording this lecture. And that will conclude this lecture for Case Study 13-1.